We have a welcome. We've had a couple welcomes. I think we had two weeks ago. Kiana and Alvaro. Kiana is with Brown University. Alvaro is out of Columbia. So I don't know that name of that university from that country. They are med students, both 2-year, second year med students. And we want to welcome Purab Kothari. There he is. Good friends with Adam. He is going to assist with some of these medically related posts, whether they're on Mondays or Tuesdays. He's a third-year med student right now at Thomason, that is not a word, at Thomas Jefferson University in Philadelphia, interested in cardiothoracic surgery. He aspires to specialize in the treatment of aortic disease across the continuum of care, from prevention and monitoring to operative treatment to long-term secondary prevention care. He enjoys spending his free time out in nature and is a believer in its ability to positively influence physical and mental well-being. So why volunteer with Aortic Hope? And he says open heart surgery is something most people hope to never need, and diseases of the aorta may affect people who might be completely healthy. Because of this, a diagnosis of an aortic aneurysm or dissection is jarring and has the potential to completely change one's life. Aortic Hope gives patients and their loved ones the resources to navigate their diagnosis and to return to a sense of normalcy to their lives. From developing patient education materials to joining support group sessions, I hope to make a small contribution in the lives of all affected by aortic disease. So let's all welcome Purab. Yes.
Welcome, Purab.
Yes. I had such a great conversation with him. And I think it dawned on me like it dawned on him. This is such a brilliant idea to be able to have the med students with us, whether they're first year, third year, it doesn't matter, because they're getting an opportunity to see behind the veil of a patient life. They see them on the table. They might see them for a few minutes before surgery if we're lucky, and they'll see them after surgery. But once they leave, that's it. Like, they may not see them for another year, right? Because we don't sometimes see our surgeons till 6 months to a year later. But these med students will be out of that hospital. So they're getting an opportunity to really see how we're impacted through being with us here at Aortic Hope. And I think it's made a profound effect on Duke, on Adam, and on Sam. Being able to read responses, read the tone, read the complete misinformation that is out here on Facebook, which is what we try to combat every day. And what I've been hearing, and I'm not going to say which med student, I'm not going to say which physician, but let's just say what I've heard is seeing the difference in old school physicians and how they work with patients versus med students who have worked with us and their way of communicating. It is night and day. Not that one is better than the other, it's if that's personal choice, but med students now have a way through working with us to converse with patients like I am with you, just kind of very open, very genuine, not minimizing, but not over dramatizing, not belittling, and not being so directive and just do as I say, which we've talked about this when it comes to acing your healthcare journey. The old school relationship of patient walks into surgeon's office, surgeon says, you have an aortic aneurysm, this is what we're going to do, and I'm going to give you a mechanical valve, and you say, yes, please, thank you, I'll see you on this date. It's not a two-way street for success. Not with how easy it is to obtain information on the internet to learn. Is mechanical really what you want? Do you want to have your chest cracked open? Do you really want to be checking your INR levels through blood tests because you're on blood thinners the rest of your life with a mechanical? Or do you want to maybe learn about a bioprosthetic and have the option of endovascular repair and not having to be on blood thinners, but maybe having to have it replaced in 12 to 15 years? It's a conversation. Your life and your health care journey should be this two-way street. It should be you explaining This is how you live your life. This is your level of activity. It will drive you nuts if you hear ticking or you don't really care. You want to be a one and done. This should be a 45-minute, hour and a half long doctor's appointment where you're learning about your anatomy, your condition. You're learning as much that you want to learn so that you can make the best educated decision with your physician for you and your lifestyle. And what I'm hearing is these med students, after working in this community, are really addressing the needs of the patient in their entirety, not just what's being presented to them during rounds. And so I kind of like when I hear that, because the old way of doing things, I think, is too regimented, but there's a lot of people that like to just be told, this is what you have, this is what we're doing, see you on this date, and they feel comforted with a plan. But I do think that because of the internet having that access, we need to have a bigger conversation than just ABC. I want to know like A and a half, E, F, G, D. I want to know, I think I forgot D. I want to know all the letters. I want to know the whys, the whats, the hows, you know, I want to know a lot more. I need to know a lot more. And I think a lot of you do too. And I think that having that easygoing, we're in this together kind of uh, way of communicating is going to be more effective in having patients return and schedule follow-ups and talk to their family because, this very well could be genetic. I just think it's going to yield a lot more positive things, but I don't know because we haven't done the research, but I just believe it. And one day I hope to see it. So yeah, welcome Purab. We're excited to have you. We're excited to see your posts. We're going to start seeing these posts from these new med students come January. They're practicing. They're practicing from now to the end of the year. So from now till the end of November, you still have Sam, Duke, and Adam. Of course, in December, if you don't know this, we don't really post educational posts. December is 31 days of hope and joy. It's a lot of interactive posts, engaging posts, and a lot of contests and a lot of winners. So we kind of want to take your mind off of it during the holiday season, whichever holiday you celebrate, and hopefully bring to you some thought-provoking questions, things that make you feel hopeful and joyful. So taking a break on those types of posts, picking it back up in January, and we're going to get to read all these fun things that our med students talk about. So welcome, Purab. Okay.